during these studies. Oh, good job, Jan, for
Yeah, I
remembering.
forgot it. Yeah, I have to click.
I'm just
Thanks.
babbling anyways, but the coolest thing was that we decided we have to be able to meet with patients from all over. And tonight's a great example of it because we have people from across the lake. But anyway, so we decided to create the backers, and it's just a bunch of patients like you and I, and we have support from our doctors, our researchers, our U of M people, and we try to come together virtually once a month. But if you were probably tapping your fingers last year and saying, "Where is Sheri? We need her." Well, Sheri had a really, really, excuse my French, shitty year. So Sheri bowed out of all things, and I'm going to tell you a little bit about that and how I rebounded. But the backers, we liked backers because our little thing was we have your back. Like you have my back and I have
Mm.
your back. Because as patients with scleroderma, or actually any autoimmune disease or sickness, it's just awesome to know that somebody else is watching out for you or giving you tips. So that is how we got our name of the backers. You do not have to be a patient at U of M. You can invite friends. Like if you have friends or family that just need to know more about this disease to help you out, you can invite them. This we're just going to make a link. Last year you had to RSVP. We're going to make it just open to whomever. So um, at the end of the meeting in the chat, if you want to be put on an email list, I'll also, Yen really is the one who sets up this stuff because I'm still technologically challenged. I probably always will be. I'm just going to accept that about myself now. But Yen will, I think an email list for some of us might be easier too. I can just email it to you. You can click on the link without having to go to Facebook. So whatever you want to do is perfect. And we're always open to suggestions. So, welcome, welcome. So excited to see you all here. Some of you are past like mentees of mine, so, and it's just I don't know. I just get so excited about this. So, excuse my little girl like blah. All right, Glenn, now you can hear me because you're laughing, so that's good. All right, so what today is going to be about is talk to you just about the backers and what we do. I'm going to tell you a little bit of why my year was so challenging last year, and the backers kind of went off the rails for a bit. Actually, it was just like it went to sleep. It took a nap, so it rested up, and now it's ready to go. Um, and then we're going to see where you are in your journeys, and we'll introduce ourselves if you want to. But just remember, if you are somewhere where you want to shut your cameras off, I did not dress up for Halloween. I decided to dress up as a tired patient. That's what I did. So, yes, I bet all of you did the same thing too. Yes, I love it, Liz. So anyways, if you need to go, if you need to shut your video off because you just don't want to be on camera, if you don't want to participate, like all of those are your choices. And I just don't want you to feel like there's no teacher here. You're not getting a grade. Nobody's judging anything. So just so you know that. And there is a chat down there. And Yen, you could maybe start off our chat and just put in there, like if anyone wants to be on an email list. And I won't make it like public. I'll blind copy everybody. But so, Yen, if you can start that. And then if you do have a question while I'm blabbling, you can chat it and we'll try to get to it. But I would like to know this about you. I'm going to take the Halloween route. We might not all celebrate. I do have a kid who's 18 and I bought him my favorite candy, of course. Um, so I ended up, I want to see what your favorite candy is or what you're passing out, or maybe you're not. This is my favorite candy in the whole wide world. It's new. It's not just regular nerds. This is gummy cluster nerds. Now, you just have to see it. Nerds are these small little candy things. And then nerd ropes, if you've seen those are at the gas stations. They're about this long. But these nerd clusters, look at that yumminess. Okay, see, those are the nerds. In the middle is like a yummy gummy thing. If you don't like candy, you're going to hate them. Don't try them. They're disgusting. So sweet. I'm a candyaholic, so I love nerds. But in my clean eating, they don't really fit in. but I'm gonna just eat a couple now. So nerds are my favorite candy. I'm not passing them out for Halloween because they don't come in individual packs that I know of. I'm passing out dollar store candy bars, and I buy this for the kids in the neighborhood because we don't have very many. You get boxes of these sugary cereals. It's all crap. So I feel bad giving it out now, but that's what I'd give out. So oh, also I am in Michigan in the Farmington area, not too far from Ann Arbor. And that's all you have to know about me. So we'll try to make this fast. Just tell me where you're at because I think it's amazing how many people we have out of state, out of country, and your favorite Halloween candy either to pass out or to eat. I'm not encouraging it, but I mean, come on, we got to live too. So I'll shut up. And Jan, you can go first.
Hello. So I am from Texas. But, no, so far, I'm currently living in Texas. I'm working from home from Texas, but I work for University of Michigan. My favorite candy, I like those gummy bears. What's that? It's just called gummy bears, right? I bought a really huge bag last week. I'm going at Costco, so I'm gonna give out next week.
I bet it's called Haribo,
Yeah, right. It's like
Haribos.
from the
Yeah.
Germany one. Yes, cool.
All right.
So
Thanks,
next
Jan.
person will be Jackie. She's right next to, I mean, the box right next to me.
You're talking to me.
Yeah, Jackie, you're up.
Okay, my favorite is Good and Plenty, but that's not my family's favorite, so I get to eat them all.
And where are you from, Jackie?
Oh, I'm in Ridgely, West Virginia.
Nice. Now, it's so funny. We have two Jackies, so we're going to have to be Jackie K and Jackie CK.
Okay.
All right, just pick someone else, Jackie.
Pardon me. Oh, the other Jackie.
Right.
Jackie
Now,
CK. There you go.
I'm from Marquette, Michigan, and my favorite candy, I believe, is Twix. I have a hard time for Twix. Something about the caramel in it.
Hear ya.
So
I hear you. That's a good one.
yeah, and this is like my favorite time of the year now. So I'm contemplating going trick or treating myself, just because my 16-year-old doesn't want to go. I'm trying to get him to go to get the candy, but
I know those teenagers, something else.
I know that's all they have to do is just go get us mom some candy. How
Come on,
hard
we
is
didn't ask that much. Moms and dads love candy. All right, pick someone, Jackie. Thank you for sharing.
okay?
Hi.
That was Kay. Okay.
Hi, I am from Adrian, Michigan, which is south of Ann Arbor and a little bit west, but north of Toledo, Ohio. So I'm in Michigan. Um, my favorite candy is anything chocolate. Um, right now, the sea salt caramel thing is kind of getting me, but I'm fine with anything chocolate.
Thanks, Kay. I agree.
How about Lisa?
Hi, Lisa. I am from Boston, and I have to go with anything chocolate, dark chocolate, milk chocolate, anything.
Awesome. And I just like hearing you say chocolate. It's perfect.
Yeah.
Lisa, is this your first time here?
Yes. And
Okay.
I don't see the list of people. Like I can't even see anybody on the Zoom. I can only
Okay.
see myself, and I know it's me. I'm terrible at this. So
Well, you can hit the view button up in the corner. Are you on a phone though?
yeah, I'm on the iPhone, my iPhone.
Can someone help her? Because I don't know that.
Like I see Zoom camera. I'm sorry,
No,
everybody.
it's all right. We can see you and it's fine. You don't have
Okay.
to see us. I mean, we're kind of
Like I see down on the bottom, it says 17 participants, and I can probably see if I click that the names, but I don't see everybody's face. So I
Well,
don't know.
Yen will try to figure it out for you. I think what you can click on is when someone talks, you can see that person on a phone, but I don't know
Okay.
what the command is. So
Okay. All
throw
right.
it in the chat if somebody knows.
Okay. But I
Right.
can't see anybody, I don't think, because I can't see them, right? Or
Yeah, I don't know. Yes.
I can do the list of people. So I pick Karen.
Karen, we can't hear you. You're on mute. Sorry. Lisa, thank you.
You're welcome.
Oh, good. Can you hear me now? Good. I live in Homer, Alaska, and I too love anything chocolate, but I'm also partial to Jelly Bellies. I went to Costco in Anchorage and got 3 giant bags of candy that we're going to be handing out. Uh, I don't know if you can see this because somehow now I have everybody up, but I have this motion activated shark that talks. And last year, we put candy in it, and it was really fun to watch the kids grab the candy out and not get bit by the shark. It actually scared the parents, but not the kids.
That is awesome. And you obviously, if you got 3 big bags, you have a lot of trick-or-treaters, I take it.
Well, I'm going into town, and that's where the prime location is. We don't get anybody at our house.
That's awesome. Awesome. Thank you, Karen. You can pick someone if you want.
Yeah, let's Kimberly.
Hello. So this is my first time here. I know I've talked to Sheri a zillion times about coming, and I love that it's evening now. It's much better than Saturday mornings. Like yeah. So, but I was no kidding. I was sleeping before. Went over to my chair in my office. I'm like, his doze. I was so tired. I'm like, I don't know if I could make it, but I'm glad I stayed.
Well, we're
So
glad to have you. What's your favorite
yeah.
candy?
Well, my favorite, I'm not a big candy person, but I like a candy bar once in a while. So just in a typical time, I'll usually grab a Snickers or the mint chocolate Kit Kats. Oh man, those are good.
Mm.
But this time of year for Halloween, I was just talking to somebody. It's like it's always the throwback to childhood stuff comes up. So I really like Smarties. And then does anyone remember the Jawbreaker Gobstuffers or Gobsmackers? Oh man, those are hard to find, but I love those too. So if I was handing stuff out, I often hand out Smarties and Gobsmack, little jawbreaker thingies if I'm handing out. But nobody comes to our door in our neighborhood anymore. So
Yeah, it's kind of, if you don't do trunk or treats, I find it's not very, that's why I went to the dollar store and got like a 5 pack of a couple candy bars that hopefully my husband will eat if not, I will. So thanks, Kimberly. I'm
yep.
so
And
glad
I'm
to
in
have
Southwest Michigan, by the way.
you. Would you mind picking someone?
Oh, yes. How about Glenn?
Hi, I'm Glenn. I'm Glenn from Novi, Michigan, which is probably what 10 miles away from Sheri. Um, my favorite candy is probably chocolate, which unfortunately for me is my major GERD's kickoff food. So I know if I have chocolate at night, probably for dessert, I'm due to an event. So anyway, it's not too bad, and I live with it, and I'll deal with it. So
You bring
anyway,
up a great point, Glenn. We'll go back to, is it worth it or not later?
it seems worth it when I have it, but 3 hours later, it's not worth it.
I know. You're like, why did I do that? I totally get it.
Exactly. Exactly.
Do you mind picking someone else, Glenn? Thank you.
Sure. Cami?
Hello, everyone. I'm Cami Novacek, and I live in Mishicot, Wisconsin, which is just outside of Green Bay. And my favorite candy is wild berry Skittles.
Mm.
See, when they start making little tweaks, like the nerds, you get a better version of the candy you loved. I like it, Cami. We're so happy that you're here today, by the way.
Thank you.
Yeah. You want to pick someone else?
Let's see. How about Elizabeth?
Took me a minute to figure out how to unmute. Hi, I'm Liz. I live in Colorado. My favorite Halloween candy, anything gummy. I really like gummies. I like Kit Kats, but I'm also celiac, so I can't have those anymore. And Twix were used to be my favorite too. They all are reminding me of the things that I love, and it's oh, I miss them.
Maybe this was a terrible idea to use the candies you can't eat anymore. Nice, Sherry.
I
Wait.
know, I know. And sugar is my big trigger. So like I try not to have sugar and in the moment Glenn is right, it's worth it. But like the next day when I can't move my hands and my feet ache so much, it's not so much.
Yeah.
So
I think you guys are more qualified today than I am because here I am eating nerds telling you how much I love candy and I just keep things out the window. And that's it. All right.
well, as you said, it's
Next.
all about balance and what give and take, and you gotta live.
That's right. That's right. Liz, at some point, it doesn't have to be today, but you are in your craft room. Is that correct?
Yes.
Yeah, someday we would like a tour of that craft room because
Oh,
I love it.
absolutely.
All right. Awesome.
Yes.
All right, Liz, go ahead and pick someone.
Um, Nancy, I don't think you've gone yet.
No, I haven't. I'm Nancy. I'm from Novi, Michigan. So I'm pretty close to Glenn and Sheri. My favorite candy, I'm kind of torn between two. Um, Gummy bears have always kind of been my thing. I love them. But there's another version of them that from England. They're called jelly babies. They're kind of like a
Good.
Yeah, they're hard to find over here. So whenever I have family members that go to England, so I'm like, you got just bring me back jelly babies. That's all I want. So it's that is my favorite. And then dark chocolate with sea salt and caramel. That it's kind of like they're two opposite ends, but those are my two favorites. And Costco sells those Saunders dark chocolate sea salt caramels. Oh my gosh, those are like so good. So it's jelly babies and the chocolate. So for me, and for Halloween for handing out, I kind of hand out whatever the store happens to have when I go the day I shop for. It's either chocolate bars or bags of chips or pretzels or something like that. Whatever the store has a nice big box of, because I like to usually buy a couple boxes. Yeah, I typically get 50 kids or so in my neighborhood. So down from when I first moved here, though, used to get 100, but
I'm
it's
jealous.
kind of dropping off these days. Not as many
Yeah.
trick-or-treaters.
Yeah. I used to want to be the cool house and give full size candy bars. And then I'd have like 5 little kids who can't even eat a full size candy bar. Their
No.
parents were probably like, "What are you giving my kid?" So then I stopped being the cool house, and I don't know.
Yeah.
It depends what we have exactly. So, thanks, Nancy. You want to pick?
Oh, yeah. How about okay, let's see. What is the name I've not seen? Is there a Lisa? Did we have Lisa yet?
Yes, I already did it.
Oh, that's right. You were towards the beginning. Okay. How about there's Elizabeth. No, we did her too. How about Una?
Hi everyone. I'm Sherry's long lost friend from about 4 years ago, Sherry. I live in Ireland, Northern Ireland, and my favorite sweets, we call them sweets over here, you call them candy, but my favorite sweets at the moment are these. You call them Mike and Ike. Yeah, they're gorgeous. So loving them.
What do you call
them? Sweets.
Okay, but you don't call them Mike and Ike sweets or not?
Yeah, they're like
Okay.
Yeah, the wee chewy jelly things. Yeah, they're like them. They're gorgeous.
Awesome, Una, that you just whipped out totally something we have here.
Oh, do you have them there as well?
Yeah,
right, okay.
We do. Yeah. I can like
Okay.
But wait, did you know what Nancy was talking about? I know you're in Ireland, but do you know what are they called, Nancy? Jolly something?
Jelly babies.
Yeah, they're the smudgy,
Yeah.
like wee baby things. Yeah, they're cool. Yeah. There's lovely ones. There's nicer version, Haribo ones. They brought out a nicer, harder version. You'd like them too, so you would.
Oh. And are they called jelly babies too with some, so I can look for them?
They are jelly babies, but they're a different texture. They're not as spongy. They're nicer.
That's
If you like
interesting.
them.
Yeah,
Yeah.
because the
So-
jelly babies are a lot like the gummy bears we have here, except they're a little bit, the jelly babies are a little bigger and they kind of have like a dusting of powdered
Yeah.
sugar over them,
Yeah.
where our gummy bears don't.
Yeah.
Una, it's so cool that you're here. How I met Una was over COVID. The spin study for scleroderma had like international, and Una and I over COVID, like we had all these people. It was so great. It was so
It was
great.
brilliant.
It's just so great
Yeah.
to see you. You look amazing, by the way.
You too.
All right. I think we have some people. I know we have. So there's an iPhone down at the bottom. I can't see a name on it. Who are you, iPhone down at the bottom?
That says Liz.
There is a Liz, and then there's an iPhone. Or is that hi?
Hi, I'm Teddy. It's my first time. I'm not sure if I belong in this group. I have morphia.
Yes, you
But,
absolutely belong here.
Oh, okay, great. I go to Michigan Health. I live in Oxford, and I'm all about anything chocolate.
Now tell me your name again.
Teddy, like
Teddy.
the bear.
Okay, easy enough. I just couldn't hear. I don't know if it was my computer.
Yeah. I put my name in the chat with my email. Thank you.
No problem, Teddy. So morphia is like, you know, you can teach some of us, but is anyone right now here have morphia? Yeah, I didn't think so. But what we talk about, Teddy, you're gonna see it's everything. So it's not always just specific to what our disease is. You know, I mean,
I see.
Yeah. So you'll get a feel for it.
Yeah. Okay. Thank
Well,
you.
welcome. We're happy to have you. And like I said, you can leave your camera on or not. It doesn't matter to us.
Yeah, I have a headache, and I'm really bad with the phone, so I think I will turn it off. Thank
Yeah,
you.
no, that's no problem. And if I ask a question and you don't want to talk or whatever, I just wanted to make sure that we at least knew who was on the other line. So
Yeah, I'm not some creep. It's
no,
just
no.
me. Yeah,
I mean,
yeah.
you know, someone might think I'm a creep, so who knows? No, I'm just teasing.
No.
Well,
All right.
yeah, we're so happy to have you, Teddy. And if you left your email in the chat, you'll
I
see
did.
our
Yeah.
next meeting through the Backers Facebook page, but you'll also get an email. So welcome.
Okay, thanks. Nice to meet you all.
Yeah,
Thank you.
no problem. And Liz, so we have Liz Elizabeth
Yes.
and we have Liz. So Liz Cronin.
That is me, yes. I'm trying to figure out the camera on my phone, so it may just be my voice for
Are
today.
you still driving? Because if you are, don't worry
Nope.
about that. Okay.
No, I'm done.
All right.
But I don't have access to the camera on my phone, so I apologize. Next time I will. So I'm Liz, and I'm new to the group. I live in the Boston area, and my favorite candy is Almond Joy. And the kids never liked those, so I was able to grab them all the time.
Oops. Yes, I can see that. My mom used to take all of our Almond Joys and what's the other one called? Mounds.
Mounds. I love mounds. Yeah. Either one. Coconut, my thing.
Absolutely. Okay. Well, Liz, welcome. And don't worry about
Thanks.
your camera. If you figure it out,
all
great.
right.
Don't.
Yeah.
And I see Anne just walked in now. Anne, I don't know if you're driving.
Yeah, I'm driving. Sorry. I'll be done in a few minutes.
It's no problem. And just tell us where you're from and your favorite kind of candy.
All right. I am Ann Bohr from Traverse City, and my favorite candy would be Reese's Peanut Butter Cups.
No one's mentioned the Reese's Peanut Butter Cups, but they are delicious. I love
They
it.
are my fave. Yes.
Yeah. Why, Glenn, why do I see two of you? It's freaking me out. No, it's so weird. It was like there was two of you for a minute.
Sorry, I'm on both on my phone and on the computer because I couldn't hear through.
Oh, that's hilarious. Okay, that's hilarious. I'm like, seriously, Glenn's using AI on me. He's really making me look bad. All right, anyways. Did we forget anybody? Everybody went, right?
No.
Me,
Who's me?
Cindy.
Oh my gosh, Cindy, hi. You snuck in here. That's why.
I
Cindy, hi.
did.
I miss you. I'm so sorry.
It's okay.
All right. Who are you, Cindy? And where are you from and all the good stuff?
I'm from Fort Mitchell, Kentucky. And let's see, we get about 150 trick-or-treaters at our house. It's supposed to rain this Thursday, so I'm not very happy because we don't have an under, so I don't know how long we'll last doing it. And I love gummy bears too. No, which is terrible, but I do.
I know we have so many. Yes, terrible but yummy.
Yeah. So, anyways,
well, thank you all. I'm just so excited to see so many people here tonight. I want you to realize that backers, just because we're supported by U of M doctors and people, I mean, we're supported, but that just means they like us. There's no money. They don't give us money, nothing. This is just run by us. There's no medical. You might hear someone tell a medical story or say, like, I'm going to tell you about a treatment that I do get at U of M through an infusion, but just so you know, this is not a medical, like, I can't give you medical advice. But it's a great place to share information, and then you can always go to your doctor and ask about it. And I think with our disease, that's an important part, to really be an advocate for yourself and to learn things. I mean, you can get on the internet also and learn things, but sometimes there's some scary stuff that is on the internet that we may not want to dive into. So the backers is really just a bunch of patients supporting each other, having each other's back. So before I start, is there anyone that has any questions or just anything before we get started here? Awesome. So like I said, Yen, you're going to keep looking at the chat, right? Because I'm really bad at that. So while I'm blabbling, if you have questions, you can either just, I guess down here where it says react, like look at, I said to who did I say this to right now? Oh, to Cindy, because she has so many trick-or-treaters. I did the wow face. So if you do, I think you can raise your hand. I don't know. I told you I'm technologically challenged. So ask Yen all of those questions or each other. But I'm going to just start and tell you a little bit about my journey last year. And then I want to focus on Raynaud's. How many of you, just like give me a thumbs up in your camera so we don't have to unmute, but how many of you suffer Raynaud's in any way, shape, or form, either on your hands, toes, ears, feet? Okay. Yeah, most of us do. And we don't all live in cold climates, but there is a season change for most of us. Even if you were in Florida, there's still types of season change. So my thing is to try to tell you a little bit about my year last year, what I did to rebound, and we're going to talk about Raynaud's. And I actually brought stuff that I'm going to try to show you. I was able to talk. Dr. Murphy can't be here. Susan couldn't be here today. She had a friend in a car accident, but she sends her love and well wishes, but she had a doctor friend that I just spoke with on the phone, and we're going to eventually get her to talk to us, or I think the National Scleroderma Foundation is going to record something she does before she retires. But Susan was like, you got to talk to this doctor, because I had so many ulcers. Nobody could do much for me anymore. That was the point where we were at. So I'm going to share some of the things she showed me today with you. And like most of the stuff you can probably find on Amazon, but interrupt me if we need to like backtrack. I do talk fast, especially when I get excited about stuff like this. So, just cut me off. Again, my name's Sheri Hicks. For those of you that don't know my past, I was diagnosed about 17 years ago, and I'm a peer mentor at University of Michigan. And we kicked off the Backers program a few years ago. I think it was before COVID, but maybe it was during COVID. I don't remember exactly, but we just noticed that virtually is so much easier to get together with people, especially when they happen to be in Ireland or Boston. So, sorry, no private jets here, but we can at least gather. And our goal is to gather once a month, and we'll see how it goes. And if you can make it, you make it. If not, there's no pressure, because we understand each other. So my bad year started in for me it was August and September. It's when, well, first of all, the weather here has been crazy warm. Like I'm in shorts and t-shirt right now in Michigan. So, and I know it's been like that all over, global warming. But normally in September, when our high school homecoming is, we march in a parade and it's in the evening. And I noticed like that's when my fingers in the evening, once the sun had gone down, start to go blue and red and white and all the colors. And I don't know. I don't want to wear gloves marching in a parade when it's still beautiful in September. Sorry, just yelling at my family. I don't know if you can hear them or not, but so I don't know what happened, but I get dead skin like under, it's like here,
Mhm.
at each finger. And those, when they open up, is an ulcer. That's what an ulcer looks like. You can Google it again if you want to pull up pictures, but they're so gross. Nobody really wants to see it. I mean, maybe they do, but um, I then have these open wounds that it feels like when you paper cut yourself and you're making a salad with lemon juice in it, and the lemon juice hits those little paper cut. That's what it feels like all the time to me. Like it's that intense pain. It's also a nerve pain. So when I go to open a car door, how many of you had this happen? Like you go to do the car door, but like you can't quite feel it because we're losing sensation,
No.
and your hand kind of like snaps and then it hits the thing and bad words fly out of my mouth for sure. So that, it's just horrible. And the pain that I was suffering then rolls into like Halloween. And then I say, Sheri, we better do something about this. So how many of you have heard, again, you can give me a thumbs up. How many of you have heard about an infusion called Velitri? The drug before that was called Flolan, and it's Yen, I never can say this word right. Estopropyl. I don't, do you know that word? Okay. Did I say it right? How many of you have ever had that treatment done? Okay. You have, Una? Okay. Is it for, do you have it done, Una, for ulcers and circulation or for pulmonary hypertension?
Well, I had the iloprost, but I couldn't tolerate the iloprost. Yeah, it's for ulcers, and because I get quite a few ulcers on my fingertips.
Okay. So it's in America, and it might be something different over there, but because in America, we've played with this a long time, and you have to get prior approval. Is that the word? Prior approval? Yeah, from your insurance company, which is a big pain. But whatever, it's well worth it. And it's a drug that is infused into your body just through IV. But because if people suffer also pulmonary hypertension, and I don't know at what point you have to get this, you also, that drug is used for that. So at U of M, floor 7C is the floor that you have it done. It's mostly all heart patients or lung patients. So they like to put you on the heart diet, and I'm always like, oh, my heart's fine. Can I just eat regular? But yeah, Glenn has given me a thumbs up. He knows that floor too. So you have to have two lines open. And what I mean by that, so if you have an IV that the medicine's going in, you have to have another IV, because one thing that can be a side effect is your heart can do some crazy things. And I'll just leave it at that because I've never really dug into that side effect. There's other side effects of the drug. I get super flushed. Like if you see me, I'm bright red. Well, I'm kind of red right now, but that is because menopause. But I get really red. And then if you think about this drug, it's opening up your little capillaries and all the vascular stuff we have going on. So it opens that up into your head. So I suffer a major headache when I'm on it. And then what's my third thing? Oh, and a little bit of nausea is my major side effects. Well, it's such a harsh drug that they run it. They've tried different things in America. I'll be curious what Una does, but we started out years ago doing 5 6-hour infusions. So you were in the hospital for 5 days. Then that was a lot of hospital time. I would go up a wall. After about 3 days, I want to climb out of there. But for your, health, you'll do it. or for the pain or whatever. So then they changed it to, I think it's 3 10-hour infusions or 30 hours in a row. It's a 30-hour treatment. I guess I didn't say that. So I personally, I used to like the 5 days only because of this reason. Your body only had to tolerate the toxic poison for 6 hours. And then I usually had them do it at night if they could run it at night. And in America, we have to do it inpatient, which is horrible. Like I want to be like going to an infusion center and just be like, hey, all right, run it for 6 hours and let me go home. But we in America, it's not approved for that yet. So right now, if you went in today, what would be is you either could go 30 hours in a row or 3 10-hour infusions. And the last one I just did a few months ago, I did 3 10-hour infusions and it was okay. Una, will you share with us what you guys do?
Yeah, over here, the hospital that I go to is a 5-day outpatient. So you go in and you have the 6 hours and then you go home and you come back the next day. So it's 5 days for the 6 hours.
Do you suffer side effects?
With the Flowlan, no. I actually sit and work on my laptop all day. It is amazing. It is, I can go up to the full, I go up to level 3, I think it is, and I could run a marathon. It's brilliant. I
Oh
love
my
it.
gosh, I'm jealous. See, look at how different people react to it. When she says level 3, so this, I mean, when you look at the pack of meds, it's like seriously this big on the IV pole. It does, you know how saline like looks like this nice plush pack that's like that big? Well, this little gold mine is like that, and it drips so slow that what Una's talking about is she can handle it at the fastest rate, which still isn't very fast, right? I mean, it's still like, and what happens, my lines will say oculation or something. So is that the right word? Oculate? Acute? When your blood starts to get like thick? I think it's oculate. Well, anyways, so this thing is going in your arm so slow that the blood is backing up into your IV because the blood in your body is now thinning out and it runs faster. So my veins, it's also a really harsh drug according to the nurses on your veins. So my veins would blow. So Glenn, does that happen to you? I'm seeing a nod of the head.
Sorry, I get to blow for different reasons, not for that one.
Okay, I get it, but I mean, you still know what it feels like to have veins blow, and many of you probably do. So my veins just can't tolerate it. So I'd blow this line, and then they'd switch it over to this line. Well, then I'm pointing at here because that's usually where it ends up because they can't find good veins, and you guys know the routine. So I talked to my rheumatologist, and I was not happy. And I was like, listen, this 30-hour infusion is taking me longer because my veins can't handle it. So the answer was try a PICC line. So we tried a PICC line, and it's an amazing thing. Amazing. Like it's not a big deal. It goes right, oh, it goes in your arm. Well, I think they all have to. I don't know. But they have guided sonogram now, and they know exactly because they go into an artery or near your artery. They don't want to go in your artery, I guess. But anyways, they watch it, and so it just says like Sheri has a PICC line in her right arm, and it shows you how many centimeters in it is. So then when they take it out, they make sure none of it falls out in your body, which it shouldn't. It's a tubing, but it has made my life so much better. And then I have to remember to ask for a double lumen, which means that if this was like where this was one tube where they hook up the infusion to, I have two hanging off of that arm. One is for to put the infusion on, and it just screws on, and the other is for in case I had some terrible heart event as a side effect. They could still get in. Wow, Siri's saying that they found something. They could put that in drug, inject it into me quickly. So it's a whole big thing though, because no doctors, and they're hospitalists when we check into the hospital. Other places, this is just at U of M, but I think it's pretty standard that it's not your rheumatologist that's checking you in, and your rheumatologist is the one who knows how the drug goes. So the hospitalist is like, you want a PICC line? Oh no, we just do it by IV. And I'm like, okay, breathe in and breathe out, Sheri. Well, sir, I've been doing this for 10 years, or ma'am, I've been doing this for 10 years, and please know that I have, and I really do, I have on my phone notes if that helps you. And I pull out my phone and it says everything on it. And my husband helps me keep it organized, like add this on there next time. Um, I was gluten free a long time ago, so they still had my gluten free diet. So, or the Heart Smart diet because it's a heart floor. So now I have normal diet on there. And I just, when I go in there, I say to the hospitalist, I know this doesn't mean anything to you, but here's my notes. Can I read it to you? And we go through it. And there's one medicine we have to hold, the sildenafil, while we're taking the iloprost or the Velitri, because it can do something crazy. I don't know. But so I just go through all the things. And then I say, can I have oxycodone? And I have that in my list. Now, I don't take oxy a lot, but when I'm in the hospital with that, I take it at least 1 or 2 for that 3-day period. I need it. And I don't try to be a hero. I'll say, can you put compazine as the nausea thing? Can you put a stool softener in case I take the narcotic? And the hospitalists, they don't like it at first when I ask for a pick, and they have to go back and read my chart. Then they have to call rheumatology, blah, blah, blah. So what I'm trying to tell you, I won't go into more details, but it's a good treatment that works, but I dread going in there for it. So when you dread something, what do? You procrastinate, or at least I do. So that's one of the problems with this treatment, just for me. Una, do you find that you're like dreading it? I mean, you don't have many side effects and you don't have to spend the night, so I'm thinking you have a different answer.
No, I actually the iloprost I could not tolerate it. I went up the iloprost. Maybe it's the same levels. You know the way you have like the level 1, level 2, level 3. I could never get past level 1, and the nurses knew my name in terms of she is going to spew all over this ward. Please stay away from that bed, because it was horrible. It was I you couldn't even, like, if I knew I was going in for iloprost, it just made me want to. I did not like it. So
Well,
then
what's the one that
Flolan,
you do? Oh, Flolan is different?
I do Flolan, and Flolan I can go to level 3, and it does the same thing. And I just work away on my laptop all day. You
Now
know,
that's interesting because I know there are different drugs. Like one used to be called well, Flolan and Velitri must be Iliopros. That must be the same. One's the generic name, right? Is that right?
I don't know. I could find out. My sister is a pharmacist, so I could ask her. But I'm pretty sure that they do the same things, but they're not the same drug.
Yeah, I
So
think you're right.
yeah, it's just I don't know what the difference is, but I know that they have the same effects. They open blood vessels and all the rest.
Absolutely. Well, I just want you to be aware that that is a treatment for these ulcers, especially when you've tried other things. Now, I I'm going to fast forward just why the year was so bad, and I'm going to retouch on that at different times. I don't want to just bore you with just all Sherry stuff, and I want to get to what you can do for your fingers if you have ulcers and or Raynaud's. But what happened is when I went in I think it was just yeah it was December. When I went in December for my Flolan Velitri treatment, I did a 5-day. I talked him into it. So I tried the 6 hours, and usually, even though I hate being there for 5 days, the 6 hours, even though it tears me down, then I can get some really good sleep, and I'm like rejuvenated for the next 6 hours the next day, if that makes sense. 10 hours just seems like a lot, and 30 hours would be way too much. I don't even know if I'd do it. But anyway, so at the end of my 5 days in December, I had to have an angiogram. Has anyone had that done? It checks for circulation either in your hands. For me, it was hands and toes. Has anyone had that procedure done, an angiogram? Well, it's not supposed to be a big deal. It's a guide wire that goes in, and I think it's like cameras. It takes pictures. It can take from 30 minutes to 2 hours. But like the hand surgeon was trying to see if I was getting flow at the tips of my fingers. So it's like a map for them to see how your circulation is doing. So they did my toes and my hand, like one leg to look at the feet and one arm to look at the hands. And if everything's flowing right, then you know that it's not a circulation problem. It's probably a scleroderma problem choking out the little vessels. But they want to double check before they try to treat you. She was going to do a hand surgery for me. So that's on the very last day, instead of checking out of the hospital and going home, it's, like an hour, maybe, not even, but they just kept me and they just wheeled me down to have the angiogram. And I was under for a good, I don't know, 4 hours, let's say, because they were doing a hand and a foot at the same time. So they didn't have to put me under twice. Well, what made my simple procedure go to hell in a handbag was um, when I was wheeled back after anesthesia. Now, I'm a talker and I'm pretty upbeat. So I'm like wheeling back and I'm a little oozy. And I was like, oh, hi to the nurses. I'm like, how are you guys doing? Blah, blah, blah. I'm kind of flying high, but I'm ready to go home, call my mom, or whatever. And the nurse looked at me and she said, Sheri, um, what did she first say? She said, how are you feeling? I said, I'm good. I'm good. How are you? Blah, blah, blah. Trying to be cheerful, Sheri. And she says, grab your phone. And I went to grab, it was like on my little table. I went to grab my phone and I dropped it. I mean, that could be anything. And then she said, take a picture of yourself. And I'm thinking, why does she want me? I look horrible. So I take a picture of myself. And she, as a nurse, noticed an ever so slight droop on one of my sides. And then she said to me, and then she got the other nurse that, and they both know me very well, thank the Lord, because I'm still here. But they asked me to put my hands out, to close my eyes and put my hands out straight. So I closed my eyes, put my hands out straight. And the same side that she saw a little droop, I pronated in my hand. I couldn't hold it straight with my eyes closed. Those are stroke signs, I guess. So they acted very quickly. The nurse looked at whoever, and I don't remember a lot of the rest of how it went, but I know stroke protocol was called, and I all of a sudden had like 20 people by me. And I'm like, what's going on? Like I am not taking, I don't know that they had me do this for stroke. I haven't had anybody close to me that has had a stroke that I knew of their symptoms. So anyways, they wheel me back down and they get a picture of my brain. And I have a piece of artery that was floating. So when they were doing the angiogram, the guide wire nicked the outside of an artery. It didn't cause a bleed or anything like that. It just took off. And how big? I have no idea. Like, I think it's minuscule piece of artery that floated then up. I mean, it was in my bloodstream and went straight to the brain. So that the CT of my brain showed that I had a stroke and they needed to go in. So, okay, so I am like, is the CT scan the thing where you have to go in the tube? Because I don't really like that. And la la la. I'm already doped up, so they should have just told me to shut up. And then as they wheeled me out of the CT, the surgeon, who was very kind, like, and there's a bunch of people, I don't know who anybody is, I'm out of it, I'm not freaking out yet because I still don't know that I've had a stroke, I don't know what's going on. So the guy says, so ma'am, you've got a few choices. You've had a stroke. And I was like, a stroke, like, yes, that's, and I said, how did that happen, whatever. Anyways, he said, well, what we need to do, we need to have you need to have a brain surgery. And I was like a cut your, I don't know, cut your skull open brain surgery. That's what I say. And then he's like, yes, and it needs to happen quickly. And I'm making light of it now because the end result, you see that I'm fine. But I normally would not be doing that if it was someone else's issues. So I said, well, I feel like my husband should know about this. I think I should call him. And they're like, yep, I think you should too. And somehow I probably can't tell you his phone number half the time because you don't call out the numbers anymore, but the surgeon himself handed me the phone. He dialed it and put me on speakerphone. And I was like, Jamie, I think you need to come back to the hospital. I need to have a brain surgery. And of course, he's like, what? So the surgeons talked to him, I guess, and he was already on his way up to the hospital because the nurses knew him and they had already contacted him and said, Jamie, just get up here. So, anyways, I went in to have what's called a thrombectomy. It's another guide wire that goes up through your leg, actually, your artery in your leg. And it's just like a thing that just grabs the clot of whatever it was. And they took it out. And I stayed in the stroke unit ICU for the next 4 days, I believe. I think it was supposed to be 5, but we beat the odds and I was out of there. But it was a medically induced stroke. And luckily for me, the brain matter that I guess, have you guys heard that saying that we don't use all of our brains? You know, I always thought that was just kind of a like smart aleck way to say, well, we can all do better, but there's matter in the brain that we don't really use. And luckily for me, where this clot went or where this piece of artery went, I have no neurological, no physical side effects. No speech, blah, blah, blah. So the neurologist, however many weeks later, told me, take a baby aspirin for a year and call me, you know. So I'm so, so very lucky. I mean, I believe those nurses saved my life. I don't know, but I didn't know I was having side effects. So the stroke then put me on a downward spiral. And I will continue the story on another time because you don't want to just hear all about my drama. But it was nothing related to scleroderma. However, it took such a toll on me, and I'm pretty positive. But I knew after a month after the stroke, I wasn't back to normal. And depression can be a side effect of lots of things, but a stroke. So I got a therapist right away. And I thought I'd be talking to the therapist about my empty nesting situation that was coming up in 6 months with my kid leaving for college. But no, we talked a lot about the stroke. And I think when you see a mortality like that, something happens to you. And I don't know if any of you have had, like, I don't know, just mortality stare you in the face thinking like, what would have happened if? And I don't like to play the what if game, but you know, Glenn, I'm going to use you as an example because I just know your story and you've told it to us, so I know you don't mind me sharing this. But when you went in for your stem cell transplant, Glenn, you know, they tell you a side effect of this could be death. And, you know, that's a hard one to choke down. I don't know if anyone's ever experienced that.
Yeah.
Sorry, yeah, it's Jerry. Yeah. I don't think it's out because I'm hearing twice. Yeah, and I had some kidney problems 6 months before. I think I called in one of the calls and I was in the hospital. And it was related to one of the medications on for scleroderma. And I had some kidney issues. It was an allergic reaction that caused blood clots in my kidney. And just like you, it was like I was a bit la la land when it happened, and I was at the after effects, and I was still in recovery from the biopsy. And suddenly I got very nauseous. They looked at me and said, and then as you said, there's 20 people around you. I'm getting a catheter. I'm getting all kinds of things. They're trying to get hold of my wife. They put me in ICU. Somebody said to one of the nurses, very nice, said to my wife, "You need to come with me. I'm a believer in prayer. We need to pray for your husband." And anyway, all things being good, it turned out fine. But yeah, these things can happen unexpectedly. They can be scary. But as the patient, I was a little bit in la la land. So I was watching all these people and asking questions. Well, I think they were intelligent questions. They probably weren't at that point. But yeah, I didn't realize how serious it was because I'm in awe of all this activity going around me. But all things being good. So it all turned out well. But sorry, one other thing is that a PICC line, I am having a couple of PICC lines. I understand, you know, they take specialist procedure and else, but I'm a big fan of PICC lines. That made my life so much easier because I think some of us with scleroderma, sometimes it's hard to find a vein. And when they do find a vein, it's poke, 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 and we'll try the other arm, and we'll try this way, and it can go on for seems like hours. It's probably 10 minutes, but so I'm with you. Pickle lines are if you need it and just they can do it, it's the way to go.
Yeah, and I think the reason they don't like to do it is because like it's a central thing. It goes right into your body, and an infection can breed. But I mean, can't you get an infection from an IV in for 5 days? I'm sure you can too. So whatever. But anybody else have like this mortality wake up thing where you're just like it just I don't know. It was crazy for me.
I recently had to have a upper and lower GI, and they did it. My GI guy did it in Brighton, and which was fine. But when I came out from it, everybody in the place came over to tell me, and of course, I'm in La La Land, you know that feeling. And everybody comes over and goes, you, we almost lost you. You didn't, you quit breathing. We had to bag you. We had to, do all this stuff. And I'm like, okay, like what am I supposed to do, And they said, well, you're fine. And I'm like, okay, And finally, when the doctor came in, he goes, we will never do this procedure here again. You will be in a hospital the next time we do this. I guess my blood oxygen level just like totally bombed out. And that's why they did that. But to me, the interesting part is they're taking the oxygen level on your finger. Okay. My fingers are scleroderma fingers and Raynaud's fingers and don't really work. So put the damn oxygen thing on my head, as opposed to there. But okay, that may not have done any good. I have talked to several people. I was at the time in pulmonary rehab anyway, and I talked to the nurses there, and they said, well, people with your lung issues, that happens all the time. And I'm like, oh, okay, well, I didn't know that. So next time with the rheumatologist, okay, this is what happened. She's like, yeah, any other procedures, let's just go to the hospital, okay? Like, okay.
That's
So,
scary, Kay. That's very scary.
well, it wasn't like, it wasn't so bad that they couldn't get it back up. Like, they used the bag, they gave me oxygen and brought it back up and it was fine. So I guess it wasn't all that scary, other than it was just weird the way everybody came in to tell me about it. And like I could change it, like, like, yeah, like almost not yelling at me, but like, like I was in trouble for what I did. And it's like, I was asleep to a thing, and it was all fine, but it is weird. And
No, those can be, I think those can be challenging when you have a disease or probably somebody probably with cancer, you know, they stage cancer and we all probably have folks, loved ones that have had cancer and you get this stage and you want it to be like one or, you don't want to hear four or whatever. But I think it's the same thing, for scleroderma, once you're um, diagnosed, you hear, oh, there's no cure. And then if you dig around on the internet, because treatments were totally, dinosaur time, but they've come a long way, but you can have that. So I don't think that that's uncommon. I don't have lung issues, so I didn't have that. Are you going? Bye. I love you.
well, and I had I mean, I've been through the cancer thing too, so I'm 8 years past that, but my oncologist would not give it a score to start with. He goes, no, we're not talking about that. We're talking about where we're going. This is what we're going to do. We're going to get this, and this is it. And we're not staging it. And then I was just back there for something else, a review of something, and he goes, yeah, okay. He's looking up things. Yeah, you were a stage 3, and we got you to a stage 0. And I'm like, I was a stage 3, like, you never told me that, which I guess
And
was good because I didn't have to worry
you don't
quite
have
as
to worry about it. Yeah. Yes. Well, I'll continue my story later because I that really was not scleroderma related, but yet we were doing a procedure for scleroderma. So whatever. Um, I believe that mentally, physically, and what am I missing? Mental, physical, and emotional. Is that right?
yeah.
Mental. I feel like I'm saying it wrong. But anyways, I feel like
No,
those,
that's right.
is that right? Mental, physical, and emotional. Okay. I feel like those three things, like if they're not in sync, you can have some issues. So we're going to talk about that, at a later time, but I wanted to at least tell you why I was absent last year. What I ended up doing was quitting all my volunteer stuff. I just couldn't. My therapist said, "What can you manage today?" And if that's one thing you take from away from today's thing is I would ask you this question. What can you manage today? And for me, I ask myself that every morning. I have a whole routine I do in the morning for my spiritual lift up. And that's one of the questions I ask myself. All right, Sheri, what can you handle for today? What can you manage? It might not be your favorite thing or whatever, but what can you manage? And if you can't manage it, it's okay. And those were words I could not live very well. I felt less if I didn't get my to-do list done or if I had to cancel on people. And it's just something that I've trained my brain over the last while to get out of. And again, these are all things we'll talk about. What I wanted to share with you is the doctor who talked about my Raynaud's said to me, Sheri, the best way to heal your ulcers is don't get them. And I was like, all right, lady, thanks a lot. I've got 5. So so I really couldn't practice what I'm about to share with you until this year when my ulcers were healed up. And usually during summer, I do heal. So that's a huge blessing. So she talked about cold, like we have to stay warm, and that's for all of our body. Now, if you are a woman of menopausal age, you may share this where you have a furnace going in your middle and it's a hot furnace. And Glenn, I'm sure when Elizabeth went through it, you knew it, or maybe she still is, but it's a hot furnace. Like you want to open up the freezer and put your body in it. So you have a furnace, but then our ears, our nose, our fingertips, and our toes are purple and freezing. So the first thing she said is you have to keep them covered. These are 100, and she swears by 100% organic cotton. Please don't go to like Bed Bath and Beyond. Well, maybe that's out of business, but don't go buy these anywhere but Amazon. I got a whole like 50 pairs of gloves for very reasonable, like $10. So she would tell you to wear these 24/7. Okay. And I got these a little big for me because my fingers are so fat. So they don't quite fit. I mean, like I have to pull them down and I'm not going to right now, but these are the best. The question, what can you manage? I cannot manage these. I can't do it 24/7. I am so envious of those of you that can. But like you're supposed to sleep in them. Put a nice layer of lotion or bag balm or Vaseline or Aquaphor or whatever, oils. I can't sleep in them. I feel, and then I need to like touch things. I must be tactile because if I'm eating a taco, I need to feel my taco. I'm not going to put these on to eat my taco. I just can't do it. So I'm going to tell you what I do and then what you're supposed to do. You're supposed to wear them all the time. It was just too much for me. I couldn't manage it. So I wear them when I can. Mostly though, I do wear these underneath like let's say we were gonna go for a snow walk. Okay, I don't do that often because it's whatever. But those hot, I didn't even bring them because I don't love them. Those heat hand warmers that you get at like Costco, you just open them and there's like charcoal in them. Well, that charcoal is terrible for, yeah, Liz has it right there. Thank you. So yeah, okay, I'm reading what Cammie's saying, but not really. But yeah, if you had open wounds and trying to do those things, it would, you couldn't. It would hurt so bad. But that charcoal dries your hands out and it's terrible for it. So if I have to use those hand warmers, I wear these. That is exactly what I do because then the charcoal will stay out here. I mean, your glove will turn black and stuff, but that's why you buy multiple. A paraffin wax machine. I own 2 now, and I'm embarrassed to tell you I haven't plugged them in yet. Ugh, I'm going to. I say it every day, but I have one for my feet and one for my hands because I just don't want to dip my feet in the same wax as my hands. That could be a me issue, but the paraffin wax machine is amazing, and you just dip, hold up, let it drip off, dip, hold up. And it's not too hot where it burns you. The more layers that you dip, the hotter it is. Um, Now, like if you have physical therapy, they'll have you put on plastic gloves, which I didn't bring those here, but they might be just plastic gloves. It comes with the wax machine, but those are not latex. They're just plastic gloves. You can also use grocery bags if you were sharing the wax like somewhere else. But what I do is I don't share it with anyone. So I have a foot one, a hand one. The hand one I dip. The more you dip, like you could do 6 layers of dip, the warmer it is. And then I have like, okay, both hands are dipped. So I can do one and I wrap it in a plastic grocery bag and then I wrap the other one. Well, it's hard to wrap the other one. So if you have somebody at home, great. If not, you can do it by yourself because I do it by myself. Then I lay.
It's just Sheri's internet problem. Sheri? Did we just lose Sheri? Let me.
Yes.
Right? Okay. Let me text her to see what's going on.
While we're waiting, has anybody else used the paraffin wax? I've never tried it, but I was thinking about it. You have, Glenn? What was your experience with it?
Yeah, sorry. I used it through some therapy I had at U of M. It was good. It was very, it was very pleasant. So what Cherry said, I dipped 5 times, let it cool down a little bit, get a layer, dip it in, then put a plastic bag and then oven mitts on top of that. So it retained the heat. It wasn't intensely hot, it was pleasantly hot. And the oven mitt really just kept the heat in after I had it.
So how often do you do that?
I was in a clinical trial, so I was doing it twice a week. To be honest, it was a clinical trial with physiotherapy as well. And I didn't notice any benefit. I know a lot of people do, and I'm not saying it's not the right thing. Just for me, it didn't work, but I did it twice a week.
Thank you.
And so you did not have open wounds though?
I did not have ulcers. No, it was strictly because my contractures, my fingers were starting to curl.
Okay. Anybody else?
Yes. Hi. Um, I have a paraffin machine and it works beautiful if you, I mean, I was using it at least once a day, sometimes twice during the winter. And it works fabulous for me. And then the only thing with me is like it can get a little messy, so you have to be careful. And I haven't turned it on yet. As a matter of fact, I need to pull it out because it's getting cold here.
Sorry, just a quick question. Did that solve the immediate problem if you had a Renault's attack? Or do you think it was preventive or long term something that benefited?
I'm sorry. For me, it just kept my fingers get very, very cold. My doctor always looks at me for Raynaud's and because they don't turn colors, but they get so cold that it hurts. So I guess that's what I have. It helps keep them warm so that they don't get painful. And I really think it's something that needs to be done at least once, if not twice a day. And you can do it as many times as you want. It's highly moisturizing. I put a lotion on first. I worked in the salon for years and we used to do them for treatments, just super hydrating, super moisturizing, and so warm.
So then, because I've never done this, if I try, how long, like you dip them, how many times do you dip yours?
I try to do it like 4 or 5 times. Sometimes, if I tend to do it a little later at night, it can be lazy and I only do it like 3 times.
Right.
But really, if you can do it like 5 times, wrap them up and then I crawl into bed and we watch TV, and it'll stay warm. Not as long as I would like it to, I will say. So sometimes if it's not, again, I'm not lazy because it's late, I'll repeat that process.
So you're saying you keep on the wax and wrapped up for like
Yes.
an hour or two?
Yeah, I'll keep it on. I'm gonna say by 30 minutes it's cold again.
Okay. Thank you.
Yes, you're welcome.
You guys see, look at everyone just takes over. What a wonderful thing. Thank you. You could be teaching it. And if any of you want to teach it, we can talk about that too. But anyway, so the wax thing, like if you were doing it at PT, probably 15 minutes is what they would do. But when it gets cold, is you want it off. This now I haven't done it with my feet yet. I have not done it, but I'm going to. That's going to be my new thing because I was starting to get ulcers on my toes and could not walk last year. So, okay, now let's pretend you do have an ulcer. So great, Sheri, you don't really want to dip an ulcer in wax. Like, absolutely do not ever do that. It will kill. I mean, I guess you could use plastic gloves, but I still think it would hurt. I don't know. You would have to be mindful of that. So what do you do if you already have an ulcer started? Well, what are okay, when you have an ulcer that starts, what are some of the annoyances with it?
I don't know about anybody else, but my fingers are very hard all the time. And so I would feel an ulcer coming on, and I know it's only a small ulcer, and then it gets harder and harder and more painful. And then it would eventually pop and then just goes back to normal again. So that's basically
And
my
when yours
experience.
pop, Una, do you have calcification that comes out, either a hard piece of calcium or toothpaste like calcium, or is it just blood, or what comes out?
I have a cheesy white substance. It can be, sometimes it can be hard or sometimes it can be runny. It just depends at what point the ulcer bursts. It's quite strange because mine starts off with a really, really small white dot, but that white dot gets bigger like a moon and then turns a wee bit like of a different color. And then I know that once the color has changed, I need to seek the antibiotic from the doctor because that's when it's infected. And then usually it pops after that.
So that's okay. You totally just, you don't always get an infection, but usually if you have calcification in these, it looks white at first, and then it changes, like I love how you say a wee bit. Like a little, for me, it's a little yellowish. I've never had green, but I think it can turn to green if you're not careful.
Yeah,
So,
my first one went green because I had no experience with it, so I didn't
yeah.
know what it was. So
Yeah, it was
yeah.
just some painful thing growing on your finger. Yeah. And Una,
Also a very
can you open, I can't remember your fingers. Will you show me your fingers? Can you, okay, you can open. Okay. Can you imagine if your fingers could not open and you had these, some people get them like on their knuckles and stuff. Like the pain is just, anyways, I'm going to show you these little blue things. You can call them finger condoms if you want to be funny. You can call them finger cots. I don't call them anything, but these are what they're called. They're finger, oh, it's going to be backwards for you. Can you still get the main gist of it though? They're called finger bandages and they're blue. And I got two sizes of them and they come like 60. Oh, this is medium. So must have got medium and large. They come 50 in a box and they are, again, they're reasonable. So what this thing does, so if you think you have an ulcer starting, so I start with dead skin. And right now I'm just so proud to say I don't have any dead skin right this minute, but I told you I'm getting these split nails, so we're going to pretend this is an ulcer, even though it's a split nail. What you would do is you put this on your finger and it rolls down and it's open. So if you took, okay, so in like CVS and stuff, you'll see these finger cots that are plastic or vinyl or whatever. And if you put that on an ulcer, which can protect it from water. Like this won't be waterproof, but what do you think happens in this waterproof setting when you put it over an ulcer?
it sweats and gets all soggy.
And
it doesn't
you can
heal.
breed infection.
Yeah,
Like,
and it doesn't
yeah.
heal.
Yeah, it can't heal. It has no air coming to it. All these things you guys are saying. Exactly. So this can breathe, but it has this, so this top part, it kind of looks like a stack, right? Like a stack. And this top thing, how did that happen? Did you do that yet? Oh my gosh, presto magic. All right. Well, this top thing, it protects it. So it's breathing in here. And if I want to go grab a box or my phone, and I'm a little clumsy or I'm hard with my hands, I guess, or maybe we all are, but like if you go to grab something, you can't bang the ulcer because this is protecting it. It protects it on the side here and it goes all the way around. So these, I wore these everywhere last year, everywhere on whatever fingers. I mean, they just come off easy. I didn't leave the house without them and I wore them in the house all the time. So they were just a lifesaver to me. They look stupid, I realize it, but like I turned them into little finger puppets, like, oh look, whatever. So whatever you have to do, but it was such a lifesaver. So this was one thing that and that was that doctor that taught me that.
Wait, what is that made out of?
It's cotton, 100% cotton.
Oh.
And it's like a spongy cotton, like it's stretchy. I'm trying to see what else it says. Yeah, because it says it's a finger bandage made with cotton. Oh, and there's some spandex in there. So that, but probably more cotton without latex, which is suitable for the recovery and treatment of fingers. Wearing finger bandages is more flexible than the traditional packaging method of a discomfort glove. And that was the other things with those white gloves, or even with like, okay, so I have lots of gloves around my house, but these are gardening gloves from like, I don't know if it's the dollar store or Ace Hardware. These gloves are good for me because they have fat fingers in them. I just found this brand at our hardware store and maybe whatever, but I have gloves everywhere. So this kind is stretchy here. So if like to put on a glove when you have an open wound is the worst thing ever. So I could actually put that blue thing on and get these over it. So if you can find anything like that, that's what I would do dishes in. Well, really, I didn't do dishes, let's be honest. Cindy, what? I feel like you're trying to flag me now. You're muted though.
Can you hold up that box again so I can take
Of course. Yes.
Thank you.
And you know what? There could be other brands of it, but
thank you.
Yeah, and I should probably have put my links from my Amazon accounts. I can do that. Not today though, but maybe next time. So those were super helpful. The other piece of it was keeping warm. So those charcoal things, of course, that's all I had at the time. And she's like, they're the worst things ever. Don't use those. Only if you have open wounds. So if they're covered, they're fine. But and those can go in mittens. Like if you have ski mittens, they're very handy. Don't get me wrong. Like I still keep them around everywhere. But she showed me this, and I wish I had if you look it up on Amazon, I'm sure you'll see it. So this, or you could make it if you're a sewer, because this one, I think this one is just rice, but maybe not. I don't know, but it has lavender in it and I love it. So this was great. You throw this in the microwave for, like, I don't know. I haven't done it yet this season, but let's say you throw it in the microwave for 2 minutes. You know when it's warm. And the inside is like lined with nice, like soft stuff. So I could put that blue bandage on, even with an ulcer, and warm my hands. Well, one, I couldn't fit my other hand in it. So one was not enough for Sheri. So I have two. So you can even, after you do your wax, you could, Una, bye. Thank you. I know it's late your time. Bye. I will put you on the email, okay? So these you just pop in the microwave. You can also pop them in the freezer. Now, for scleroderma people, I don't know why we would ever do that, but if somebody needed an ice pack or something, you can put it in the freezer. I forget, these were like $30 each, so they weren't cheap, but they've held up. And like, I mean, I use them for everything. Now, if I just come home and especially from winter, like if you just unloaded groceries, your hands are freezing, even if you have gloves on, I throw them in the microwave, I put them on both hands and just shellacs. They're the best. She also said though, but you can't do anything with those on. So then she showed me these. I guess that's the company, STR Strive. Oh, hello, Sheri. Strive. That's a word. You put these are like gel filled, and the material's spandex, I guess, like a workout material. These you heat up and they go on your wrists. Now, Kay, can you hold up your hands? Because you have on, do you see those? Are those knitted? I'm guessing. Okay. So Kay has on the knitted ones, and if you keep your wrists warm, I mean, it's not always going to keep your fingers warm, but if you keep your wrists warm, that could help your fingers. So if you have to be doing something on the computer and you have to type, let's just say you're working, you could throw these in the microwave and they come in a set and you can still type. Now, for me, that didn't cut it when I was totally inflamed. It didn't do enough. So that's why these purple guys, but you can't do anything with these, which is okay. We're allowed to sit down and rest, but tell your mind that when you have a list to do, right? So finger cuts or bandages, lifesaver. And then there's these white ones that I couldn't find any today. I was hoping that I had them, but I don't. My little emergency kit didn't have them. They're just white cotton that just go over your fingers. And for me, she wanted me to put you're not supposed to let your ulcers dry out according to her, because once they dry out, they crack. And then if they weren't open, they are now open. So then you have ulcers that have cracks, and that's how they get infected. So she would say put Aquaphor or Vaseline on it and then put one of those white things on when you go to bed if you can't handle the gloves. Oh, that's what it looks like. It just looks like a glove finger. Those white gloves I had, which I don't know where I put them, but it just looks like one of those fingers. And they come in like 100. They're all organic cotton. You can find those on Amazon too. So at least it would be clean. You put your Aquaphor on your little ulcer or whatever, and then you put that thing on. You could put the blue thing over it. I've done that before. You could just wear gloves. I just don't like to sleep in them. So that's what those are.
Sheri, how long does the wrist thing that you put in the microwave, how long does that stay warm?
For me, it stayed warm for like a half an hour. It wasn't as hot as it was. I think it depends how, like Cammie, if you can handle it really warm at the beginning, like it just probably depends. So yeah.
Because what I've done is, they have those sweatbands that have the zip in it.
Yeah. How do those work?
They were good, and I put the hand warmers in there.
Okay.
So it's great because then it frees up my hands and I can do stuff.
Yes.
But that bulge that the hand warmer causes tends to still get in the way if I'm trying to type or.
Sure.
And then it also gets how it gets sort of hard as it keeps going.
Yeah.
And then it's stiffened, and that kind of causes pain with the flexion. So that's interesting to see those.
Yeah, they're just real squishy and pretty comfortable, honestly. I don't do a ton of typing with them on because they're just kind of like, I don't know, it like invades your space. But
yeah.
Kimberly, bye. Thank you. We're going to actually wrap things up. So those were, I didn't show you everything. So we'll still little by little. But what my hope is for next time we meet in November, I want to talk about something called biofeedback. Has anyone done biofeedback yet?
No.
Okay. You have, Cammie?
Well, not for scleroderma, but I've done it for headaches.
You know what it is. Okay.
Yeah.
I mean, I've never done it and I'm not going to be able to do it before next month, but I've heard some good things about it and I'm just curious. I'll try to find somebody that does it for scleroderma. If you know of anyone, let me know. But Cammie, maybe, pardon?
What is it? I've never heard of it.
Cammie?
So it's basically I'm going to say it's a mindfulness thing, but like when I did it back in the day, I had migraine headaches, and it's interesting now that I have scleroderma because one of the things that she hooked me up to this biofeedback machine where you can monitor your breathing or measuring how your it must have been your pulse or your breathing is being regulated. And then I was to focus on warming my hands, actually. So I would say my hands are getting warmer, my hands are getting warmer. And the the goal was to take the pressure off of my head, like to stop thinking about my head and have that relax, because that then opened up the blood vessels, and focusing on my hands. But I think you could focus on really anything, but the probes were connected to my hands so they could measure how my hands are actually getting warmer. So, and it does work.
Wow. Okay.
Yeah.
Thank you.
And did help with my headaches too. But I never even until right this minute thought about it for my hands for scleroderma.
Yeah.
Yeah, no, it's interesting. I love medicine, but because there's no cure, I like functional medicine interwoven. And that's what we're finding out through a lot of these studies, like the Renew study. Like, you have to have your mind right in order to do the physical stuff. I mean, not always, like, it can be off a little, but the mind and the body are so connected that it's silly to just focus on one and not the other. Or if you do, then it's going to creep up on you that you're still not healed or you're still having symptoms. So I just really strongly believe in both. And biofeedback deals with breathing and stuff. And I'll hopefully, maybe I can find like a YouTube video of somebody if I don't know anyone. Oh my God, there's a giant picture of us back there. Wow. Okay, that's my cute little family, but I didn't realize it was in my screen. It's like a poster, really. I'm weird. Okay, but I love them. So,
Sheri,
pardon?
Sheri,
Yes.
what was the name of those purple things that you put your hands in? I can't find them.
All right. I will give me a second and stay on the thing. And whoever wants to see them, I'll try to put the link I'll either show you the link or I'll put it in the chat if I know how.
Okay, great. Thank you.
Give me just a second to do that. We're going to meet again on, oh gosh, where's my little note? So normally I'm not going to just blabble the whole time. I just felt like I owed everybody kind of an explanation, and I wanted to give the explanation that the backers didn't just disappear. It's so near and dear to my heart. So it just, and Mary is still going to be around and helping, and so is Jamie. But this is the one thing that I am, oh my gosh, what are you saying, Elizabeth? Liz, something good. What does it say? Make it easier on yourself and oh my gosh, yeah, see, right there, thank you. Why can't my brain do that? Thank you for thinking for me. I will put it on the Facebook link. So lost my train of thought because that was such a good one, but we're going to continue with the backers until we see a reason not to. The foundation does amazing. If you're not part of a support group and that's what you want to do, you can contact Cami, you can contact me, Yen, we can give you information. The support groups now I think are mostly all virtual. Cami, do you run one or do you go to Anita's? I can't remember.
I run one.
Okay.
But then I have to go to Anita's to support her. So we support each other. But yeah, mine is on Thursday, the fourth Thursday of the month.
So support groups, I mean, they do kind of the same things we do here. You know, in the backers, we normally do, we try to use a lot of humor. We try to have a guest speaker. Mo is not here today, but Mo is another patient who introduced us to a drum, what do you call it? Drum fitness? Okay. And I was feeling terrible. I was in my bed doing it, and it was the coolest thing. Drumming. I guess it's called drumming. But you're like, you beat with, like, you could use 2 wooden spoons and a workout ball or whatever. But it was so fun, and we had a great time. Cardio drumming. Yes. Thank you. Thank you.
Oh.
See, you guys just fill it in. Yeah. Thank you. I want to try a virtual painting one. I think Anita's done that, but I've seen other places do it. You just have to buy a canvas, get some paper. I don't know. We'll figure it out. But next month, what I'd like to do, if you have any people that you would see as a guest speaker, and if you want to tell me your ideas, I'll contact them. Hang out just for a minute if you can after. Yen, will you put my Sheri.hick1234 Gmail in the chat so anyone can email me? Thanks. And then Yen's going to put in my email and put my phone number in too to text me if that's easier for you guys. But if you have any ideas or something cool you want to do, just keep in mind we have zero money, so that's another thing. But most times people will help us out. Hey, Crafty Schmafty over there, think of a craft. Yeah, you, exactly. Anita, our friend Anita, she's crafty too, but we can do crafts. Anita did awesome snowflakes one year for us. I think it was snowflakes. All right, hold on, but I gotta find this last thing about November 17th. No, that's not right. November 19th at 6:30. What is that? What does Nancy have? Nancy, what do you have? Something cool. You're muted though. Still muted. I can't. Yeah, I don't know
There
why.
we go.
Oh,
Okay.
there. Okay.
I was taking a screenshot of the email that Yen put up. That was
Oh, okay, perfect. Okay, perfect. Thank you. I'm sorry. I thought you were showing me something else. It looked like makeup to me, and I was like, "What?"
well, it's got a little goldy glitter
Okay.
kind of thingy on the back of
I
it.
need glitter in my life, just not on my floor. um, but I want to talk about clean eating. That's been a big part of my journey. And so we're gonna talk about clean eating. So if you have any clean eating tips, if you know of anybody that is a guru in clean eating, I follow someone on social media, but I want to talk about clean eatings and can we do it through the holidays? Like, what does that look like? All the way from Halloween, okay, let's skip through Halloween. Let's talk about from November until the new year. Can we clean eat and how do we do that? So I'm going to talk a little bit about clean eating, what my journey's been, and sugar is a trigger for me. So is alcohol, so is dark chocolate. So are all the things that I love, of course. So I found some tweaks around it and I still do everything in moderation. So we're going to talk about clean eating during the holidays. I'd also like to hear from you guys about any stress relievers. We talked about this the last couple years, but holidays can get tricky. You can get personality issues, family issues, whatever. How do you stay sane during the holidays? Any hacks that you have or tips, we'll take. And then the one thing I'm going to challenge you to is I get so excited and overwhelmed. I could really only tell you this much of my journey from last year till now, but I've added positive things in my life. I'm not perfect. I am human. They don't all happen all the time. But one of the things, if you don't do already, is water has been a friend of mine. How many of you drink water all day long and you're good at water? Okay. And some of you can't drink water. That's okay. Hey, I love the transparency.
I'm trying.
Some people can't do water all day long because if you bend over, it comes out if we don't have that muscle here. So I've had that happen. But I know this sounds very bougie, but I have my little Stanley that I love. This one's too heavy for me. Actually, this is my house Stanley because it's 40 ounces. But if I drink 2 of these a day, I'm done. And if I drink some tea, herbal tea in there or decaf, one of these might be good enough. And then what was the other thing? Oh, and then so water would be a challenge. That would be the challenge I'd say to try to add for the month. I can give you tons of tips on how to do it. But if water's not that, think of one other thing. I bought a rebounder on Marketplace for very cheap. Now, rebounders are like mini trampolines. Oh my gosh, we're totally at past 8. Well, anyways, can't picture myself jumping on it, but there's like my mom has 80-something-year-old women that do balance things on my rebounder or on rebounders, and it's supposed to drain your lymph system. I don't know how all that works yet, but I'm telling you, so you can hold me accountable next month. Here's my thing. Ask me how the rebounder's going because it's been sitting in that bedroom in a dusty pile for a long time. So I'm going to find out something about my rebounder. I'm not going to go crazy and just start jumping. I'm going to do my research and start with 1 minute. So if I see you in 30 days, maybe I'll be up to 15. So think about something that you can, we'll hold you accountable. If you want to put it in there or just tell me real quick, you can. I hate going over and I didn't realize that it's already after 8. So with that.
Do you have a date for next month?
November 19th. at 6:30. I'm not even going to put it in on the Facebook page until closer to. Nobody knows. You can put it in your date books now. Maybe I'll put out one thing, or Yen, you can. And then I will not even bug you until that. I can help with clean eating. Great. Liz, we'll talk for sure. Anybody else have anything for the good of the cause for everybody? It was a lot of Sheri. Sorry, it's not the Sheri show every time, but
I have one thing that, and I don't have it in front of me, but for keeping your core warm, and it's made by Zippo, and it's like $30, and you wear it around your neck, and it's rechargeable. You can plug it in and recharge it. It's got different temperatures. I don't wear it against skin.
Yeah,
but,
okay. But a shirt over a shirt,
yeah, but it's really, for me being outdoors in the winter, which
Yeah.
I live in Alaska, it's been really helpful.
That's awesome. Thank you. I'm going to look for that online. This is just something I didn't get to show you, but look at this fleecy hot. It's a heating pad, but it's fleece, and look at how big it is. And the whole thing, like my kid was using it for his back injury, but I just snuggle right on up with this thing. All right, listen, it's so great to see you. Thank you for being here. If you want to chat more, hang out here. I will look up my Amazon stuff. I can throw it in the Facebook chat, just not tonight because I'll be done after I'm done here. But in the next day or two, look for it. And Yen, people have asked to see a recording, so maybe we'll throw that on there too. I don't know. All right, well, thank you guys. Be well.
Thank you so much. Thank you. It was good to see you.
Mwah.